Yes, I'm working in my ITA section, the Middle East, in the Congress that held in Dubai. I was a moderator in that Congress, ITI Congress Middle East, Dubai, October. I'm also a member in the ITI Study Club in Abu Dhabi, also in Dubai. We have the joint study club, and we have lectures like 4 times a year. We have international speakers for that. Actually, my patients, they are interested in both functional and as well as aesthetics. I have a fully edentulous patient. Yeah, they do care to have function, to have restoration for function, for mastication, for good, better chewing, as well as they are also demanding aesthetics. So my aesthetics is a concern as well as the function. So I work on both. All the time I explain to my patient there is nothing to replace a dental implant for a missing tooth. So the patient might be afraid to have a rod inside the bone and this metal, how it will last, how they will going to. So I explain to them simply that it is more easier and less painful than tooth extraction, and there is no bleeding, and it is a long solution for their missing teeth. We have to start from the end. A successful restoration should be prosthetically driven. If I want to place an implant for a center to restore a central incisor, I have to keep in mind the profile, how it will look in the future. So you have to start from the end, start from the prosthetic. Keep in mind all before your surgery how restoration looks like. So to start from the end is my key for a good restoration. I keep tracking for the latest development from the international team of implantology, its websites, online academy, the congresses and conferences they hold yearly, annually, and the Middle East, last one is the Middle East Congress held in Dubai, and also the workshop held by the ITI and Straumann, like in Germany or in Switzerland, wherever, all over the world.